Today we are in Marabella, one of the 3 sites we have today dedicated to COVID-19 vaccines. One of the sites we are outside Superfarm, where we are promoting and doing the one-shot and done vaccination program. To date, we have vaccinated just over 41% of the population with their first shot and about 35% with their second shot. Those are decent numbers, but we need to get them better. For the start of this week, from Monday the 27th of September, we have noticed about a 50% increase in uptake over the corresponding period last week. Whilst that is good, it is a 50% uptake from a relatively low base. So we need to continue this drive to vaccinate more and more people so that more and more people's lives can be saved. I want to emphasize that. The main purpose of vaccinations is to save lives. And I have Alberta here who could tell you her story about being vaccinated. Okay. So Alberta's life is saved. As we move into another phase of fighting the virus, we have to recognize that lockdowns and all these measures have basically run its course. With a vaccine now, we have this tool. We have this tool that will prevent us from having economic uncertainty, have people re-employed, and have our safe zone concept operationalized from October the 11th. That is the purpose to get this country and the world back to some degree of normalcy. That is as much as I can say at this point in time. I'm sure you will have questions. I want to address a couple of issues which I'm sure you are going to ask. I want to thank all the nurses who came out to perform their duties this morning. The numbers coming into us is that we have had about a 90 to 95% nursing turnout. And I really want to congratulate our nursing personnel who have come out in almost normal numbers. Those areas where we have a couple shortfalls, the RHAs, and Dr. Amor can speak about that, they have engaged their contingency plans. And the feedback is absolutely no patient care has been compromised. We will continue to engage our nursing personnel constructively and respectfully as we solve and continue to solve and address their valid concerns. So that is where we are. We have had a 90 to 95% turnout of nursing personnel. I want to thank them for their dedication to duty. Things are working quite smoothly. All our A&Es are well manned and well nursed this morning. The other issue I want to address is that lady who got the second shot of the vaccine that she ought not to have gotten. I spoke to her personally yesterday morning. I understood the facts of the case, and then I subsequently asked the Director of Health at Northwest RHA, Dr. Anthony Parkinson, to treat with her medically and clinically and psychologically. She is to come in next week to get the second dose of her correct vaccine. She is well, no adverse events because she got the incorrect second dose. She is doing well, although psychologically she was concerned, as anybody would be. But between myself and Dr. Parkinson, we talked with her, met with her, and treated with the issue. So that is where we are this morning. I will now like Alberta to tell you her particular story, why she got vaccinated, because it is these testimonials that reach the people more than a Minister of Health.
Before you tell me, my question, Minister, what have you to say to those 5% of nurses who have stayed away?
Oh no.
What does Minister? Yeah.
I will continue to say, as I said, we will treat with your issues respectfully, and the issues have largely been solved at the ERHA and the Southwest RHA, and we continue to treat with them. Some of the issues are before the Chief Personnel Officer, And I want to thank that 90 to 95% who have come up. Go ahead.
Pleasant good morning to everybody.
Say your
My
name.
name is Alberta Morris. I am 70 years old. I said I did not wanted to take the vaccine, but I make up my mind and took it. Since I take it, I haven't felt anything. And this 17th of June, I took the first vaccine. Then after, on the 7th of July, I took it. I just only feel a little sting. And I went home, relaxed, do all my work. And the next morning when I get up, I said nothing. I was very good. And peace in God and sight. So my master was known.
So, Alberta, what do you want to say to other people who would have been feeling like you a bit apprehensive about taking the vaccine?
Because it have some of them, when I tell them to take it, they say they're not taking it. So you have to take it. Don't want the children to take it. Take it to save your life and your family. Because my daughter took hers, her father, Wanda took his own, my daughter Stacy took hers, and then my son-in-law took his. Because my last son said he's not taking it because he's afraid of bleeding. When he see any needle or anything, he just kind of freaked.
Okay. Thank you. Any questions, ladies and gentlemen? Any questions?
Yes,
Yes.
there are a couple of questions.
Yes, go ahead.
In terms of the safe zones, I know that Minister Stewart Young said that we will get updated on things like the criteria. But how does one go about applying for this, and will it also apply to places that are presently open in terms of like large groceries, large
Okay.
establishments, churches, etc.?
Okay. So the safe zone context or concept, the safe zone concept is directly mainly to those areas of economy and business that engage in leisure activities. Leisure and entertainment where you have to take off your mask. That is the danger. So it will not apply as yet, hopefully not, to churches and retail shopping. Because in retail shopping you can keep your mask on. But when you go to a cinema, you want to eat and drink something, a casino or restaurant or bar. And the danger is when you take off your mask, that's when you get spread. So the safe zone concept is targeted to those industries to open them back up, have vitality in the economy, create jobs. We are now going beyond saving lives, where we can now do two things: save lives and livelihoods. So that is why we chose those industries to be part of the safe zone concept.
Right, but what is the process? How do you go
So
about
all that will be revealed. We are working on all those things now with the Attorney General, and believe me, you don't have long again to wait.
And given that schools have, well, are scheduled to be open on Monday, what about, like, I know you may say refer this to the Ministry of Education, but I'm still asking.
No problem.
In terms of universities and other institutions.
Please contact the principal of the university on those, but I don't speak on behalf of the principal of the university.
Minister, will you all be hiring more health inspectors to monitor these businesses that are open? How are we to be sure that they are going to be following the guidelines?
So we'll be, the Attorney General, as I said, wait, you don't have long again to wait for all these questions to be answered. I don't want to preempt the Attorney General, but believe me when I say you don't have long again to wait for all those questions to be answered.
But the health inspectors, the question would fall under your ministry?
Yes.
Right, so would there be an increase?
So you don't have long again to wait for all those details, because it has to be, some of that has to be based on legislation under the public health regulation. Believe me, you don't have long again to wait.
Do you have any updated information in terms of the 12 to 18 age bracket, those who have been vaccinated?
Yes, and if you give me 1 minute,
Sure.
I will dig into my phone and give you the exact numbers.
And if you could go a bit further, those from forms 4 to 6 in terms of who would, because they are the ones that will be going out should they be
So,
vaccinated.
the vaccination rate for the 12 to 18, which is about 2 days old, this data is about 2 days old. First dose, 41,207. Second dose, 28,275. So that is where we are. Out of an eligible population, according to the Ministry of Education, of about 90,000.
Are you satisfied with this number
No,
at present?
I am never satisfied with these numbers. These numbers should have been up by to about 60, 70,000 by now, but we work with what we have.
Okay, one question. Okay, one last question regarding the what measures are
Yeah. So we did a post-mortem of what happened there, and we are, although this is an isolated case, we have to make sure it doesn't happen again. So we have ordered a total revamp of how we question people, because the main responsibility lies with us to make sure that people actually get the correct vaccine. So there's going to be, well, there has been a post-mortem of that issue, and the staff administering vaccines, now that you are administering more than one vaccine, have been retrained, have been re-advised as to how to make sure this doesn't happen again. Our policies and procedures have been looked at again.
Minister, seeing that the vaccine isn't mandatory in the country right now, right? In terms of police officers who isn't vaccinated, can they arrest someone at the CSO who shows up unvaccinated?
Yes, they can.
They can?
Not arrest.
Well, try.
No. It is going, you don't have long again to wait before all those legal matters are discussed. Right? Just hold on a little bit again.
One more question.
Yeah.
In terms of persons who are not vaccinated, but who cannot be vaccinated due to whatever medical reason or whatever, will there be any exemption for them
So
to be allowed
you don't
into these
have
places?
long again to wait. All, ladies and gentlemen, all those issues have been addressed by the Honorable Attorney General. I got the brief yesterday, and the appropriate announcement will be made by the Attorney General as to how we move forward with all of these very valid questions that you are asking. Okay?
Minister, just
Yes,
one thing from
sure.
me. Of course, we would have heard about fake vaccination cards, but what is in place to prevent people from getting vaccinated with two different sets of vaccines? So, for instance, if somebody has been fully vaccinated with, let's say, the Sinopharm vaccine, and they tell themselves they want to travel to somewhere, but they accept the Johnson & Johnson, what prevents them from already being vaccinated, getting vaccinated again?
So what we are doing, we are building up our database behind the scenes. I said this at the press conference last week, Saturday, and so on. So persons who want to travel have to come to us to get an international card, and that is when we will track them. But we also look at it at the point of vaccination, because most of it is on a database right now. So we can catch most of it as we stand now.
Minister, would you all be issuing a smaller card for this, instead of working with these?
Yes.
Tell us a little bit about how you apply.
So it's not a smaller card, thank you, Ivan. What we are moving, as we said, is the QR code on your phone, as other countries have done. So we are, same thing, we are inputting all that data now into our database, and as Minister Young indicated last week, Saturday, in about 6 to 8 weeks, we hope to have that system up, where you can have your vaccination status on your phone with a QR code, and you just scan it. So you don't have to walk around with a physical card. That is what we are moving towards, Ivan.
But would the entities, the little small companies, have the readers for these things? I mean,
Well, it will be up to them to have those readers. It's not expensive technology. The same way the smallest of shop now does barcode scanning at a cashier level. It is not expensive technology, and it will boost your business.
Given that you're along that line, would there be any, subvention or anything for persons who may want to purchase those type of specialized equipment?
None of them are aware of.
Yeah.
Would that equipment be linked to a database that they could verify what they're reading and the QR
No,
code?
this will be just to verify your phone, what is on your phone. Because the link that your database will be revealing patient information.
Thank you.
Any other questions, ladies and gentlemen? I want to thank you. I really want to thank mainstream media for really being an ally in this fight against COVID-19 and being vaccinated. Mainstream media has been very, very good in getting out the messages. All. I really want to thank you. We could not have done this without you. And the figures that we are reporting, over 41% first dose, 34, 35% second dose, is a testimony to us working together. Thank you all very much for coming out this morning. May God bless you.
CNC3 boy.
Ivan, you like back at all?
Spread the actual truth about vaccinations and what they can do to really help us and to keep us safe, to keep Trinidad and Tobago safe and get us back to somewhat normal standard of living. So I appreciate all of the hard work that you've been doing, Minister.
Thank you very much.
Thank you for coming.
Minister, are you seeing a lot of vaccine hesitancy in your community as you do your walks? And what have you been doing to combat that in your constituency?
I wouldn't say hesitancy. I think some people have become complacent in that, you know, they figure that they can get vaccinated at any time now. And unfortunately, that's I mean, you are putting your life at risk. You're playing Russian roulette with your life. I don't know why you would do that. So we all want to get back to a normal state of living, or somewhat normal, and we depend on everyone playing their part. Whatever vaccine is available to you, get that as soon as possible. The studies have shown that it will dramatically reduce your chances of being affected by COVID, and even if you are, it reduces your chances of dying or being hospitalized by COVID. Please get vaccinated now.
Thank you, Brian.
All right.
I see Mrs. Manning, these days are tall.
Which Mrs. Manning is talking about?
That's junior tall.
Ivan, you like back at all? And those who come.
You can come back.
Come.
Yes, no, guys, let's
Nursey,
go back with
Nursey.
Netflix.
Let's go back up.
I want Nursey next to you.
So you also do the beef vaccination?
I want this on the front page tomorrow. Right? Guardian, Express, Newsy, front page tomorrow.
What about you, NC3? You said it, not me.
Ivan boy, I'm a partner.
Right? Thank you all. Thank you.
Thank you so much.
Get some shots. Anybody take a vaccine? Anybody take inside?
Yeah, come now.
Yeah, we will.
But now I'm going to run to come into this picture. Do so. Nice. That is the picture.
Because that's all you need to do, right? Because that's to take out the task.
Net inside.
No, take off that.
Take it off,
Yeah,
right.
take off, and just hold the lever.
Sorry.
Net inside.
Beautiful. Sorry. Nice guns, what?
Okay?
Beautiful.
Mission accomplished. That's how Dr. will take his vaccine.
Yes, sir.
Yeah, he take his vaccine.
There's this gentleman here, you'll get his consent, right?
Okay. The doctor had the thing because I couldn't get it.
Okay.
What are you doing?
Sorry. How are you doing?
Not as good as you. Wow. I thought this was sick people. If the guys are still in good, it's cost so long.
You want to take a vial and just keep it for
It's
Sunday.
not just us now. So when you see these stripes, if you see the zebra and anything white, that is good. When you see the zebra and the faces and then it's alright. Complete up a little more.
Yeah. Like a red thing.
You should see these zebra and the masses.
Not out in the hat, there's a in drive-through, there's a
Right.
thing and put in the
It's steady.
Yes. You will take it. Thank you very much. Yes. Thank you all.
Terrance wanted to make sure that the children were vaccinated. I was really impressed to see they were coming in by the numbers, so they had to extend it for more than 1 day. I want to compliment the parents and the children for accepting the vaccine. And it was only from that area, people came from all over into the community. Once they know the vaccine are available, they come in.
By chance, I don't know if you may have any data in terms of those type of communities or generally from your information and average.
No, I don't have the data. But we work through the corporation.
Right.
The RGs.
Thanks a lot.
Thank you, former mayor.
He has to put that job.
Yeah, that
Yeah, thanks. Oh, well, I'll tell you something. I paid for that myself. I paid $4,500.